long have you been tracking or following overdoses in Lane County?
For years, since the onset of fentanyl and before, the county and the state make sure that we have accurate data, as accurate as we can have, for the amount of visits to our emergency departments, the amount of deaths that we see, and the amount of 911 calls that are overdose related.
Around when did fentanyl start to appear to be a problem?
In Oregon, you really see a sharp increase in overdose deaths and other burdens around 2019, 2020. That's when we know that fentanyl really became prolific in the drug landscape of illicit and street-based drugs.
So for the past 5 years, we've been seeing this become a big problem for our
A crisis. Very much a crisis. Each and every year in Lane County and in Oregon, we see more deaths since 2020. 2024, we're still out to see what the numbers, if they've changed, but we know in 2023 we broke the records of the previous years.
What is the problem? Why is this happening?
It's complicated. First off, fentanyl is very strong. It's gripping. Someone that has had a long-term opioid use disorder or someone that's never had any opioid use issues, they find their way to fentanyl. It's gripping. It causes extreme addiction very quick, very hard.
So you said we've seen increased numbers since 2020. 2023, roughly, what did the numbers look like for overdoses?
We know that it hit the 200 mark and went above in Lane County for people that lost their lives, likely due to fentanyl.
Who lost their lives. And is there a specific part of Lane County where you saw this most?
Geographically, we don't see specific trends in specific areas that we're able to track. We know that it's more populous in the metropolitan region. Eugene and Springfield are hit a little harder than some of the rural areas, but there's no area that's not impacted at some point.
You're into prevention. This is your lane. This is what you do. What are the efforts that the health department is undertaking to, put a dent in this crisis, as you called it?
Sure. We think about prevention being both upstream and downstream. We know that downstream prevention, things like harm reduction, access to naloxone, fentanyl testing strips, things that can prevent death, is a downstream effort, but we have great agencies, great Lane County public health efforts out there making sure that naloxone is in the communities that are most at risk. When we think about upstream prevention, we think about access to treatment, recovery, education, making sure young people know about this issue and the risk to illicit drug use.
Let's dive into that. Making sure young people know about it. Explain the programming you have around that.
Sure. Our program is called Fentanyl Aware Lane County, and you can find it online. We're on social media. We're in our schools and other community organizations, really making sure that the conversation is prompted. We don't want people to ignore this. We want people to normalize the conversation that might be scary to have and think about the fact that we have people in our community of all ages that are dying from this drug, and that kind of hiding it, shaming it, and stereotyping it does not serve anyone any benefit.
With young people, what are the youngest ages we're seeing kids get into this?
I think it's not about necessarily how young are folks, but how risky is experimentation? How risky is recreational drug use? We know that this substance can making its way into everyday pills, everyday looking pills that, as many of us know, are very normal in our culture. People are not thinking that pills are as deadly as they could be when we're also used to everyday pills.
I'm wondering, are kids getting it in a way that looks more appealing to them?
I think what happens is that people are not aware that pills that go around being sold as things like Adderall or Xanax or pain meds are not what they say they are. They are, in fact, potentially a counterfeit med that looks like anything but is potentially containing fentanyl.
What can the community do?
Talk about it. Talk to your loved ones. Talk to the young people in your life. Talk to the people in your communities. We have people right outside our doors that are suffering with this gripping addiction. We do not have the capacity to fix it. The demand is too high. So we really need to normalize a conversation that people are aware and not scared to have a talk about things like naloxone, about fentanyl, about the risk to pills.
You called it a crisis, and you said the numbers are rising. So this question might not make sense totally, but I want to know from your perspective just how big of an issue this is from the health department's perspective.
Mm-hmm. The health department continues to know this is a concern in our community. Across the nation, especially in Oregon, we have numbers that really indicate we are not near the end here in Oregon or Lane County.
How can community agencies join forces better, or are they joining forces right now to work together to, I know you can't get rid of addiction, but to thwart it somewhat?
I think so. I think Lane County Public Health, Lane County Health Department, many of our community organizations that use Measure 110 funding to prop up more programming, to hire more support specialists, we are headed in the right direction. Going at the speed we need to can sometimes be what trips us up.
I'm going to start with the amount of overdoses the city has seen so far up to this point this year.
So this year we've responded to 160 or 161, I think, calls for service involving overdose, and that doesn't necessarily mean it's fentanyl. The way we track is just by overdose. So it could be some other drugs, alcohol, but they're a small portion of that. I would say 90+% of those are all fentanyl related, whether it was intentional use of fentanyl or other drugs that had fentanyl in them. Those are what we're seeing out on the street.
And compared to total numbers from last year, is it about on track?
So we are actually trending a little bit behind last year. So we're slightly lower in the calls, the reports that are generated if there is an overdose. And so in the city of Springfield, we are slightly behind where we were last year. We're trending a few percent lower than 2023, which is a good thing. We're still looking at reasons as to why that is. I think a big piece of that is kind of the public knowledge has increased, recently, and the over-the-counter availability of Narcan or other anti-overdose medications have probably played a part in lowering our responses to those types of calls.
And Narcan, how effective is it?
So it can be, very effective when administered promptly and correctly. The thing we're seeing with fentanyl is it's such a potent drug that it's requiring more doses of Narcan, and so when enough is administered, it's successful still, but it's definitely harder to treat than some of our previous opioids, heroin, for example.
And as far as seizures, what are we seeing in Springfield?
So year to date, we've seized multiple pounds of confirmed fentanyl. Just in Springfield police cases, I think we're over 8 pounds total, closer to 10. And that's primarily on large seizures, targeted drug enforcement and interdiction type cases. And then, multiple smaller, user level, street level seizures on those like overdose type calls. And so, we're in the multiple pounds just for our city. And I think data shows just a couple milligrams is a lethal dose. And there's, enough in a pound of fentanyl for, 100,000 plus overdose deaths, potentially. And so it's definitely something that we're aware of and doing our best to kind of combat.
That sounds very scary. And also in comparison to last year, seizures are up or down?
I would say they're up slightly. We've done a few things in Springfield. Actually, they're up almost significantly. I'll start over. Overall, our seizures are probably up. We've done a few things to kind of focus on the fentanyl crisis, and with some staffing changes and some decisions we've made, we've been able to dedicate an officer in a narcotics detection canine to a drug enforcement task force, and so they're working in that capacity full time to help focus on this problem. And so with that, we have more time and capability to work these types of cases.
Could that potentially be a part of why there's fewer overdoses, less of it is out in the community?
I would hope so. It's one of those things that's always an uphill battle, and we feel like we're starting to make an impact. I think it's a little bit early to attribute that to the numbers we're seeing, but there's definitely probably some relation there, and time will tell.
You touched on it quite a bit already, but could you expand on the efforts underway by SP SPD to deal with this issue?
Sure. Like I said, we have a full-time task force officer with a narcotics detection canine working with our DEA partners on a task force to focus on kind of the high-level narcotics cases, interstate trafficking and those types of cases. We've also recently started a crime reduction unit that's gotten some attention recently over some retail theft missions that they've run. But that team's also designed not just for one area of focus, but to focus on anything that we identify as needing specialty attention. Fentanyl overdose being another mission for that team. They haven't focused a ton on it yet, but with the recriminalization that has occurred here in Oregon, it's something that's going to allow them to kind of focus their efforts at a more localized level here in Springfield. On top of that, with the recriminalization that's occurred, we have a generation of officers that have an experience working low-level or street-level possession-type drug cases, and so we're ramping up our training and working with our interagency partners, the district attorney's office, to try to figure out what that's going to look like in this new era of drug enforcement.
I've read that fentanyl can even be dangerous in the air, and I know that could be problematic if there are children in a room or a home where this is being used. How can people in the community help with this effort, protect their family? What can the average person do?
Sure. I think the biggest thing is the awareness, stories like this, and having knowledge that this stuff is around, and it's prevalent and potent, and so you don't have to be paranoid or overly concerned with the airborne nature of it. As an example, that's if you open a baggie and the powder kind of puffs into the air, that's where it's a danger in the air. You're not going to walk into a room and if nothing's been disturbed and it's just hanging in the air, that's not how it's going to work. But certainly, taking items, certainly any kind of powders or drugs of any kind, even if it's marijuana or something that's legal, depending on the sources, it could be laced or contain amounts of fentanyl, and as potent as it is, that's where you can see that unintentional exposure to those types of things. Surfaces, obviously, if it's left behind on a countertop or table, those types of materials can kind of hold on to that powder, and so just being aware, whether it's probably the big one is unintentional exposure through other items, whether it's tobacco or marijuana or even some of the other illegal drugs. A lot of our methamphetamines contain elements of fentanyl now, not necessarily intentionally, but it's so prevalent in the illegal narcotics world that it's part of it now, and so that's where you start seeing some of this unintentional exposure. And so just being aware, when in doubt, reach out to the police. Whether you see an unknown powder, or given something that you're not sure what it is. I think I can speak for all of the officers here that we'd much rather prevent an overdose than get somebody in trouble or make an arrest. There's actually language in the statute about the overdose side of it where you're able to make that call for help and not have to face or worry about being charged with a crime necessarily if you're trying to seek assistance for somebody experiencing overdose. And so working together, I think we can vet out what is safe and what isn't.
And I want to kind of touch on just how much of it a problem or how worried SPD is about fentanyl in the community. Is it something it's growing rapidly, or you're more like, we've got a handle on this, or in the middle somewhere?
Yeah, I would describe it as certainly something we're aware of, something that's on our top 5 list of things to focus on. It's probably not our top priority. I mean, our top priority is just community safety, right? But if you start breaking that down, what elements to that come into play, and fentanyl's certainly one of them, and not just fentanyl, but illegal drugs in general are a priority. Now with the recriminalization, we'll be able to kind of focus some different investigative type tools to enforce all drug crime. And with that, we'll take on the fentanyl challenge. It's certainly something that we don't go through a day, certainly don't make it a week where it's not part of what our officers are dealing with, whether it's an overdose or a seizure or some other interaction that's fentanyl related. A bunch of our theft, retail theft certainly goes back to addiction, fentanyl, and they're trying to feed that addiction by stealing. So a bunch of our non-drug related crimes you can trace back to drugs. And so you can't look at any one piece of the puzzle, but looking at the whole picture, it's certainly something we're going to focus on.
And my last question for you actually came up with, because you mentioned recriminalization twice. Do you think deflection programs will make an impact on this as well?
Absolutely. So I think the multi-pronged approach that we've kind of worked our way towards in Oregon will certainly be beneficial. And so there's any number of different avenues where we can stop the behavior, and whether that's deflection pre-arrest, arrest and drug court or diversion after the arrest, or the criminal justice system with arrest and prosecution, we'll be able to kind of attack it in the most effective way possible for each individual.
What is Eugene seeing as far as number of overdoses?
The overdose numbers are really kind of hard to calculate, and the reason that is, I can tell you that the overdose currently are at a low point, so we haven't seen as many overdoses, but because a lot of people, if say they overdose and on the street, then or in a house, and we respond, then we can calculate that. But if they overdose and then they are taken by ambulance to the hospital, and whether they're medically stationary after that or they pass away, those results don't come back. So we don't really know, and I think that's kind of a problem everywhere, and I've mentioned that, and other folks have mentioned that as well, that if we can somehow collaborate with the hospitals statewide, it'll give us a better picture of what that is. And it's not really for a criminal investigation, although there are criminal investigations that can occur from overdoses. It's more just for statistics. And
what about seizures? Have you had a lot of seizures this year, up to date?
Yes, cumulatively, I guess in the last year we've had right around maybe 30 pounds of fentanyl, and that's a cumulative. So when I say that, we do a multitude of search warrants in our investigations, and so some search warrants we can get a pound of fentanyl, 1,000 pills, maybe 10,000 pills, and so really gauging it on the weight isn't always the best way, because say 1,000 fentanyl pills, which is referred to as a boat, they don't often, that's not a huge amount of weight, and so, but 1,000 pills, that's a lot, right? So I'd say as far as pills go, we probably seized right around, probably 100,000 pills. As far as powder, fentanyl powder goes, and if it's pure fentanyl, then we probably seized roughly 10 to 15 pounds of that. And then if you combine the fentanyl that's combined with, say, cocaine, or combined with methamphetamine, or combined with xylazine or just cutting agents, then what you end up with is kind of skewed weights, right? Because you have cocaine, you have fentanyl, you have methamphetamine, you have fentanyl. It's all mixed together. So
are these numbers seeming to climb?
They ebb and flow, just like everything else. What happens is we have a very strong interdiction effort that we've put together in Eugene, and we collaborate with outside agencies such as the DEA, OSP, HSI. So we have a collaborative effort with them, so it makes it a little bit easier for us to gather some intel and to help our community. And so what we found from that is we're not seeing as much heavy loads of those things happening as they were, say, post-pandemic, 2020-ish is really when we started to see a major push. But the unfortunate outcome from that is it's great for Eugene, but because of our efforts in really hammering these people and taking them to prosecution and putting them in prison with the DA's office being aggressive, what that does is it affects outlying communities, because so the other communities in Lane County now have a larger amount of that because whoever's bringing it in, say it's the cartels that are supplying this, it's safer for them to be in, say, Cottage Grove or Veneta or the Coast, or somewhere where there's not strong interdiction efforts happening.
So, and you mentioned the cartel. What are some of the other ways that this is coming into our community?
It really is, for the most part. We don't really get a lot of shipments in via U.S. mail or parcel services like FedEx or UPS. It's still happening through transit on the interstates. We're a high traffic, or we would be considered in Eugene a HIDTA zone, which is high intensity drug trafficking area. And we're doing some things right now, although we're not currently HIDTA affiliated. We are doing everything we can. Back in the day when INET was around, they had a HIDTA designation. They had an obligated district attorney, they had resources, they had interagency networking and working together collaboratively with an actual unit. And we're working towards that, but the logistics on that takes time, right? And staffing. And so what we do is we work on cases that and we work on building the cases so it has the lowest amount of impact staffing wise for the department. So it's really kind of and then we're there to assist the patrol effort on the street crimes unit, because that's what I do, is I work on the street crimes unit. So that's kind of.
What can community members do to help with this effort?
Well, as far as our unit goes, we operate, about 95% of our cases are developed through human intelligence. And that can be from a tip, that can be from a source, an informant. And so without the public's efforts to say, hey, something strange is going on, or something like that, we believe there's drug dealing happening, and they give us good descriptions, maybe license plates, maybe some photographs, that actually starts our investigation. And it's not enough for us, and it's okay to be anonymous, but for us it's really helpful if we get real detailed stuff, what's happening. A lot of people, we live in a video world. A lot of people have home video. They have videos on their phones, on their cars, and if we can get that embedded with the tips, you've already started our investigation for us. And so then we just have to put together our operations plan on how we're going to attack that particular problem. Because each problem in Eugene is different, right? So you have to deal with different things. If it's an unhoused issue, where we're having a lot of issues, say in heavily populated unhoused areas, our approach is completely different than if we're dealing with one house, in a neighborhood. Completely opposite directions of how we would even attack that problem.
So, as a problem, is this a major concern? Is this maybe a mild, it's not a top priority? Where does fentanyl fall on the spectrum?
Fentanyl is the number one priority. I mean, everything. So, fentanyl is in everything, as I said in the opening portion of the interview. That fentanyl is being put into everything, and there's even things that they're putting into fentanyl now, like xylazine or thorazine, that are just absolutely deadly. The xylazines, thorazines, they don't. Narcan doesn't work for that, and so if we can spend 4 milligram Narcan doses, nasal doses to somebody, and it won't have any effect, because the xylazine is preventing that, because it's a horse tranquilizer. It's a sedative, where fentanyl is a depressant. It's a synthetic heroin.
Do you think that deflection will impact fentanyl at all?
Well, I think that it's something that's new like this. In reading through House Bill 4002, and where I think that it's the right idea, but like Measure 110, and I'm not here to make enemies, but Measure 110, I think that people's hearts were in the right place, but they didn't have any logistics, any infrastructure, anything. I mean, 2 years after Measure 110, I was called in and asked to give feedback and help with an upcoming business. They told me that recently had received like $43 million for this process. And they said, well, how do you think we should start? And I said, probably a phone number. They didn't have a phone number, so they didn't have a way to call. So if somebody did want to call, they didn't have a phone number. So I think that when they're starting programs like that, it shouldn't be just at the onset of any kind of program, there should be input by law enforcement, the fire department, and that entity. What's your end goal? Because their end goal and our end goal is totally different. But we can combine together. What are you looking for? This is how we can help you get there. But you need to have some certain things in place. The state still, there still isn't very many places in Oregon that have a structure for somebody to go to. And I think deflection will work, but I don't know if and this is my opinion, I just don't think that having people in the field with us coming, hey, this person wants deflection, and then we have a social worker or something come out to us. I think the better place for them would be in the court setting, at an arraignment, just like a diversion for a Dewey. I think that a person would benefit from that, because then the judge can say, hey, this is your first offense, or it was a misdemeanor amount. Would you like deflection? And then explain that to the person. And if then they say, yeah, I think deflection would be something I'd be interested in. Okay, we're going to have you go out in the hallway and meet with somebody that can explain the process of deflection. And until that's done, because we can't be the instructional guide so much on the street, we try to, but I don't think it has the impact that it does when you make somebody come to court. That shows some responsibility, and then also to make a decision in court. How do I want to proceed with this? How do I want to proceed with my life? Do I want my life? Do I want just to take the conviction, take a couple days in jail, and be on with my life, or do I actually really want to get off narcotics?
For my last question, can you do an over-the-shoulder rider shot?
Sure. Over your shoulder.
Let me know when you're ready.
There's action.
You look like my niece. It's so easy to talk to you.
Oh my God.
It's like, yeah, absolutely. And we can move or adjust if we need to.
This is good right here. All right. That
Okay.
works.
Okay, so my last question for you, Brad. Looking ahead, what methods will EPD use to kind of continue to go after this?
Well, I still think that in any time you're dealing with narcotic investigations, whether it's fentanyl or anything else, you still have to go back to the beef of what police work is, and that's hitting the streets. And but right now, we can leverage our technology, and we can do better data collection and better data analysis. But I think really, for the most part, we need the public needs to continue to trust us and what we're doing, because we really are doing it for the benefit of the community. We can't stop addiction, I don't think, just outright. But what we can do a lot to control it. We can do a lot to control the flow of these things, and the flow of narcotics can be as free as the flow of information that comes to us. We also work with other agencies, federal agencies, that have resources that are not available, and so like in-house treatments and stuff. that does require a little bit of different efforts, but we have had successful, at least 3 successful people that have gone through a federal program and actually became fruitful members in society and have gotten away from their addiction. This is something that this is worse than the epidemic, the COVID epidemic, for sure. It's a nationwide thing, and fentanyl impacts everybody. It impacts families. You know, the death rate is super high compared to any other addiction thing. I mean, heroin used to be the thing, but fentanyl has kind of just taken over. And honestly, we don't realize in Oregon, which people may not know, what happens at the border, we generally don't realize it for about 3 months. So if there's a new product coming in, it'll take time to get to us. And then once we get that, then we'll put out information through different law enforcement networks so everybody knows, hey, there's this coming in or this coming in. There's really not a strength in fentanyl. It's just, you know, it's super powerful, and the dangers, and people need to be really aware of the dangers of it, especially kids, you know, athletes, so on and so forth, because they're, you know, maybe they have a legitimate pain in their knee or their shoulder or something, and take one of these, you know, it'll make your pain go away. Well, with those little pills, they're like a chocolate chip cookie, right? I love chocolate chip cookies, and sometimes the chocolate chips are heavy on one side, my favorite part. Well, it does the same thing with the pill. And so the fentanyl can be heavy on one side. So if people split the pill up in a quarter, you get a quarter, you get a quarter, you get a quarter, everybody may not get high at all. And then one person dies because it's heavy on that side. So people just need to be aware of that.